everyone. Welcome to another episode. Today I have with me a special guest. Her name is Vanessa Smith, and she is a physician's associate. For those of you who aren't in the know, physician's assistants recently changed their title to physician's associate. And so throughout this talk, I will be referring to physician associate as PAs for short. And so Vanessa took time out of her schedule to come and share with us. And I'm so grateful to have you here, Vanessa.
Yes, thank you for having me.
So tell us a little bit about how you got started in the health field.
Yeah, so my undergraduate degree was in athletic training, so working with athletes and their injuries. And I loved the idea of taking care of people, helping people rehab and get better. But all athletics and sports are nights and weekends. And I just didn't see that being an enjoyable future. So started looking at other options for graduate level health science degrees, and PA programs started to come up more and more, and really loved the idea of working as a member of a team, but also being in a role of authority, in the sense of that people would come to me for advice, and I would be in athletic training. We learned how to evaluate and who to refer to, and I wanted to be the one that got referred to, that people sent people to me, that I would be able to help them then and go to the next steps.
So good. And how long have you been working in the PA space?
14 years.
14 years. Okay, so you're very seasoned.
Yes. Yep. 14 years. And all of it has been in orthopedic hand surgery. So really spent a lot of time getting to know the anatomy between the fingertip and the elbow. Very
good. And you know, in occupational medicine, a lot of the injuries that we see are orthopedic hand injuries. What would you say is one of the biggest challenges you've come across in the ortho space?
Yes, well, we have a lot of people come to orthopedic hand clinic to get a diagnosis. What's wrong? This happened at work. I was most recently, we had an elderly gentleman working a manual labor job, and he, after pushing something onto a shelf, has incredible pain throughout his whole upper extremity that we can't explain. So sometimes it's just the problem solving of, is there something actual mechanical that we can fix with a surgery, or is there more? And oftentimes there's more. There's other things causing symptoms, and there's also a lot of mental illness playing a role. And the patient's perception of pain is very affected by their mental wellness.
That is a theme that we see throughout occupational medicine as well, where if a person has depression, anxiety, adjustment disorder, there are large stressors going on at home, that is really going to impact the way that they show up to our clinic, the way that they respond to the care that we're trying to give them, and ultimately how quickly they're able to return back to their normal life and their work routine. You know, of all of the things that you observe in orthopedics, what is something that you see that may be a common theme in terms of preventing injuries?
Mm-hmm. We see a lot of fingertip crush injuries, whether it's from a saw or a similar wrenching mechanism. And many times I will ask the patient, is there a better way to do what you're doing? What you describe is you using your body as a tool to get something done. When could we think smarter? Is there some other device that we could invent or utilize so you're not putting harm and stress on your body?
Mm-hmm, mm-hmm. That's so good. I know a lot of times I talk to patients about, the pace of your work. Are you moving super fast, and that's predisposing you to injuring yourself because you're not able to orient where your digits are in space? Perhaps you feel rushed to finish a certain task, so you're not able to be as careful as you would have been had you were able to slow down. But certainly engineering out certain aspects of the job task is an excellent way of trying to prevent injuries. Mm-hmm. Well, now, Vanessa, you've come up with a new company called Ortho Refresh. Can you tell us a little bit about that?
Yes. I've just, over my 14 years of being in orthopedics, have seen a gap that with what is being taught in school, in medical school, nurse practitioner school, PA school, and what those same providers need to know and be able to perform on the job. So the goal of orthorefresh.com is to fill the gap. And so it is an online library of talks, videos, how-to videos to help providers in occupational medicine settings, ER, acute care or urgent care, family medicine, those places that see the orthopedic injuries before it gets to the specialist. So there is a component of Ortho Refresh that is a free resource. You don't need a login. You don't need to pay anything. It's free, and it's all videos on how to do different splinting, casting techniques, different things like that as a resource. Then I'm partnering with specialists from around the world to create a library of talks that are specific for these providers. And so equipping them, educating them, what are very common injuries, common orthopedic conditions, not just hand and wrist. We're doing the entire orthopedic system. So shoulder and elbow, hip, knee, foot and ankle, spine, concussion, peds, all of those things. We're building a library, and these are all talks, very engaging, and they're short and accessible. So this is not an hour-long exhaustive talk on one particular subject, but it's an 8-minute talk on how to review or how to examine the hip, and a 10-minute talk on the difference between tennis elbow and radial tunnel syndrome, and what you can do as a primary care provider to diagnose it, treat it, and when to refer to the specialist.
I love that you have created this, because we have over 129 million full-time workers in the US, and the majority of those visits are not taken care of by the specialist. These workers are going to their primary care doctor. So the fact that you created an easy access point for primary care doctors to fill in the gaps. I mean, I remember being in medical school and we had like one lecture on how to examine someone's knee. And then I get into occupational medicine and I realize that there's so much more to examining someone's knee than the one little lecture we got in the 4 years of education. And so I can definitely see how doctors and Ps and PAs would benefit from this product. If a medical provider would like to access Ortho Refresh and reach out to you, what's the best way to contact you?
Yes. Yep. Email would be orthorefresh, just as it sounds, no spaces, @gmail.com. orthorefresh@gmail.com. The website, orthorefresh.com, has a lot of information on there too. The premium membership, there are individual membership options that are monthly and annual. And then there are also membership options for schools, for NP, PA, medical schools, and also for healthcare systems. And there are tiered pricing structures based on how many providers you have. And so those are all things that we are excited to work with you on.
Excellent. Well, everyone, you heard it here on Ascend. We've got our friend Vanessa Smith and Ortho Refresh looking for more ways to help medical providers take the best care of injured workers. Until next time, peace.
Great. Thank you.